This segment is sponsored by DHR Health.
Good morning and welcome back to Daytime with Kimberly and Esteban. Today, our team is dropping by the DHR Health Diabetes and Endocrinology Institute in Edinburgh to speak with Dr. Twahira about what we should keep in mind this Diabetes Awareness Month. Take a look.
Well, given that one of the major reasons why people become diabetic is really excessive weight or obesity, and given that this area here is either number one or number two over the past 5-10 years in obesity, if we're really going to fight diabetes, we need to try to fight obesity. And we do counsel also on that end, because we do understand that even though diabetes has many reasons why people become diabetic, there are about probably 8 different reasons why people become diabetic. But the really major one is obesity. So we do offer also that service to try to really get to the root of diabetes. Well, again, if you live in the Valley and you're Latino Hispanics, we invite you to know what your sugars are. If you want to have more profound assessment and to know where you are with diabetes, come see us. We're here for you.
So diabetes is a disease that involves a lot of things. So it needs to be treated by a group of people. A doctor that is going to be guiding your disease will tell you what kind of disease do you have, how bad the disease is, and then it will guide you with the medication. But it will involve a multiple team. So we at our center, we have a team of nutritionists that will tell you exactly what are your meal intake, what we should be eating. Then a group of pharmacists that will work with us to try to work with insurances in terms of what kind of medications you need to be, how you need to be injected, what type of medications you need to take. And even from the psychological point of view, because diabetes is really hard to deal sometimes, we have counselors as well in our center. So it's a multidisciplinary team taking care of one patient as a whole. So diabetes, the most common type of diabetes that we see is the diabetes type 2. That is a type of diabetes that happens and occurs in patients above 30, although we're seeing more younger people with diabetes. And then it's a disease that happens because of increase in weight. So insulin is a hormone that gets the blood sugar inside of the cells, and then because of weight gain, that hormone does not work correctly. So we are not able to process the blood sugar as we're supposed to, and then the blood sugar starts accumulating in the body. So the main thing that drives the disease is increased weight. What is behind weight gain? Sedentary lifestyle, inadequate food intake, a lot of carbs in the meal, and then lack of physical activity.
The professional and passionate team at DHR Health in Edinburgh is here to help. Feel free to drop by their Diabetes and Endocrinology Institute at 2609 Michelangelo Drive in Edinburgh. You can also give them a call at 956-632-5650.